The first shipment of AstraZeneca vaccines donated by the World Health Organization-led COVAX facility has finally arrived in the country. However, the Philippine government still has no rollout date for these vaccines. Rosalie Cos will tell us why live. Yes, Rosalie, good evening. Does the government have a priority list wherein the Philippines will deliver the first batch of AstraZeneca vaccines?
William, the Interim National Immunization Technical Advisory Group, or INITAG, is still finalizing the priority list of the first batch of AstraZeneca vaccines which arrived in the country. But what is clear is that all vaccine supplies for the first quarter of the year will be allocated to all healthcare workers in the country. President Rodrigo Duterte will personally lead the welcome ceremony of the first shipment of AstraZeneca vaccines from the COVAX facility.
This is a total of 487,200 doses of COVID-19 vaccines developed in South Korea and donated by 12 countries in Europe. The vaccines came from Belgium and made a stopover at Bangkok, Thailand before arriving in the Philippines through a commercial flight. Upon arrival at NAIA Terminal 3, the vaccines were towed to Villamor Air Base Kalayaan Hall for a simple ceremony led by President Rodrigo Duterte. From Villamor, it will be transported to a cold storage facility in Marikina City. AstraZeneca vaccines will be distributed the same way Sinovac vaccines were distributed. This is once the priority list of INITAG is finalized and approved by the Interagency Task Force. The AstraZeneca vaccines will be distributed first to COVID-19 referral hospitals, the other Department of Health hospitals, public hospitals, and private hospitals. Unlike Sinovac vaccines, which were distributed a day after arrival, the rollout of AstraZeneca vaccines is yet to be determined.
Aaprubahan pa po yan ng NITAG, but I don't see them deviating from the protocol that they established for Sinovac. And definitely, masusunod po yung ating national vaccination plan, providing for the different priorities.
Meanwhile, in his speech in Valenzuela City this afternoon, President Duterte reiterated he is waiting for the Sinopharm vaccines. He also revealed that China will donate another 400,000 doses of COVID-19 vaccines apart from the 600,000 doses of Sinovac vaccines or CoronaVac.
Others might prefer other brands. The doctors are very discriminating. They're waiting for Pfizer. Ang akin is Sinopharm, China. Hindi masyado ako maano dyan sa mga produkto ng puti. So, ganun. But I will be receiving another batch. And then, another, China would give us another 400, making their donation to this country 1 million.
Meanwhile, the palace official reiterated that the top priority of the government in its vaccination program are the health workers. This following the vaccination of some government officials, apart from those who were directed to be vaccinated first, like Vaccine SAR and National Task Force Chief Implementer, Secretary Carlito Galvez, Deputy Chief Implementer Vince Dicen, and Metropolitan Manila Development Authority Chairman Benhur Abalos. According to the palace, there was a problem with the information dissemination, so some government officials have been inoculated already with Sinovac, such as Interior Undersecretary Jonathan Malaya and Metropolitan Manila Development Authority Chief of Staff Mike Salalima.
So ang buong akala nila, they were doing the country a service by having themselves vaccinated. No? Pero kung yun po yun, no? Talagang in good faith, hindi daw po alam ni Yusek Malaya na pinagbawal na ng NITAG. Actually, ako po, no, kamuntik na rin ako sa PGH, kung hindi naubusan sa PGH.
William, Malacanang ensures the vaccination program of the government will continue despite the 1 million doses supply of vaccine in the country as of the moment. He adds all health workers who want to be vaccinated will be accommodated and all hospitals will have an allocation of COVID-19 vaccines. Back to you, William.
Yes, thank you, Rosalie Cos, for that report on AstraZeneca vaccine.